Tyrone Hospital is a 25-bed community hospital that provides general medical, surgical, and emergency care. It is a viable, high-quality, and growing small rural hospital. But neither the hospital's birth nor its recent success came easily. In the early 1900s, Harvey Gray, a prominent Tyrone businessman, had a vision to build a hospital to serve Tyrone and surrounding areas. Mr. Gray and his wife Ada bequeathed a sum of $150,000 to be used as seed money to establish Tyrone Hospital. Numerous community residents, businesses, and social and civic organizations donated time and funds to support the effort. In the post-World War II economy, the community raised nearly $500,000. Donated funds included a contribution from Tyrone's famous son, Fred Waring, who gave a benefit concert in Tyrone to support the cause. First patient on September 20th, 1954, it was considered one of Tyrone's greatest accomplishments. Tyrone Hospital's first few decades of operation were marked by profitability and expansion of its medical staff and services, and facility and technology upgrades. The hospital service area grew from Tyrone to include northern Blair County and communities in neighboring counties. The hospital's property was also developed. In addition to the hospital, 4 medical office buildings were also constructed on the hospital campus. By 2000, things changed. It became increasingly difficult for a small hospital like Tyrone to weather the challenges posed by an ever-changing healthcare industry. As a result, Tyrone Hospital lost its footing. It was beset with operating losses that stressed the hospital for several years. Hospital leaders regrouped. In 2004, Tyrone Hospital converted to a critical access hospital. In March 2009, a final plan to emerge from bankruptcy was submitted. By August 2010, Tyrone Hospital was fully emerged from bankruptcy. The last phase of bankruptcy and the period immediately following would prove to be a turnaround time for Tyrone Hospital. In 2009, new executive leadership was in place. Stephen C. Gilday assumed responsibility as Chief Executive Officer. There were also new leaders for finance, nursing, performance improvement, and human resources. Priorities were to develop high-quality care, address physician leadership in key areas, increase volume, and regain the confidence of the community. The existing medical staff and hospital services provided a foundation to build upon. New medical directors were recruited for the emergency department and radiology. A hospitalist and inpatient care specialist was also introduced. Relationships formed with regional health providers in recent years expanded the services at the Tyrone Hospital. In April 2011, a project was launched to convert all of the hospital's semi-private inpatient rooms to private suites. Growth of Tyrone's medical staff, increased service utilization, and positive patient feedback is evidence of the renewed confidence in Tyrone Hospital. With recent accomplishments and plans in development for the future, Tyrone Hospital is positioned for continued success.